Good morning, everyone. So the clouds have parted, the sun is out, and it is indeed a beautiful day in Harlem, and an important one as well, because we're here to celebrate the opening of this spectacular new facility in addition to the Harlem Hospital Center that is nothing short of magnificent. This new state-of-the-art pavilion represents our commitment to protecting and preserving the health of the Harlem community that we serve. I am proud to say that it's a mission we steadfastly uphold. To be successful, a project of this scope requires a community of collaboration. This new pavilion is a tribute to the hard work of all those designers, builders, staff, who have made this center of future health and healing a reality. And it's a testament also to the leadership of Harlem Hospital, past and present, who respected the noble history of the hospital while steering it boldly into the future. Another solid cornerstone of progress for Harlem Hospital has always been its Community Advisory Board, and the CAB's vision and support kept the Harlemness in this building, which we all know is a good thing. I am pleased to see several members of our Board of Directors here today, as well as many of our senior HHC leaders, and of course, so many representatives of Harlem's clinical and administrative teams. I thank you all for your tireless dedication, your passion for this great hospital, and for never failing to make patient safety and quality care your highest priority. And I'm grateful to the Fund for HHC for planning the events of today and tonight, and for sharing my aspirations for HHC. Finally, and most of all, I would like to thank our mayor. His commitment to public health and our city's public hospital system have been unwavering, and that commitment has been a driving force behind measurable improvements of health care, health status, and the quality of life for all New Yorkers. It is my honor to introduce his honor, Mayor Michael R. Bloomberg.
Al, thank you, and good morning, everyone. I can't hear you. It's a good morning. Come on, good morning. That's a lot better. And Al, thank you for your leadership of the finest public health hospital system in the country. It is really, you know, we in New York take so many things for granted. The rest of the country put together doesn't equal this. It is great to be here at the celebration of Harlem Hospital's beautiful state-of-the-art new pavilion. But I've been trying to decide what is the best ways to honor this occasion. Do I play a few lines of the beautiful jazz standard Harlem Nocturne? Do I sing a few bars of the song Harlem by Bill Withers? Or do I just let loose and do the Harlem Shake? Well, I'm glad you knew what the Harlem Shake was, because backstage I asked some people and they did not. But on second thought, I'm not going to show off. Instead, I'm just going to say how proud our administration is to have spearheaded the $325 million Harlem Hospital Modernization. And yes, this is great. And how grateful we are to the many supporters and contributors who helped make this transformation possible. And that includes the Dormitory Authority Chairman Alfonso Carney and elected leaders like Congressman Charlie Rangel, State Senator Bill Perkins, and Assemblyman Keith Wright, City Council members Inez Dickens and Robert Jackson, and Borough President Scott Stringer. And it certainly also includes the Health and Hospital Corporation's new Global Ambassador, music producer, and philanthropist Kasseem Swizz Beatz Dean. And it includes many private citizens who have contributed the philanthropic arm of New York City's Health and Hospitals Corporation, the Fund for HHC. Harlem Hospital has been a pillar of this community for more than a century, and under the leadership of Network Senior Vice President Iris Jimenez Hernandez, Medical Director Dr. Maurice Wright, and Executive Director Denise Soares, this new pavilion will help ensure, yes, they deserve a round of applause. This new pavilion will help ensure that Harlem Hospital's proud legacy continues well into the future. And it's another major step in our administration's commitment to reducing health disparities and ensuring that every New Yorker has access to quality health care. And it's designed to address some of the most pressing health challenges many Harlem residents face. When work is completed, the hospital will have a new adult and pediatric emergency departments, a redesigned women's imaging center, 6 modernized operating rooms, 4 special procedure rooms, and a newly designated post-anesthesia care unit, as well as an expanded hemodialysis unit that can accommodate double the number of patients as before. And this first-rate patient care will take place in one of the most beautiful environments imaginable. The Mural Pavilion is home to the first major commission awarded to African-American artists by our federal government, from Georgette Seabrook's Recreation in Harlem to Alfred Krimis' Modern Surgery and Anesthesia to Vertis Hayes' Pursuit of Happiness. These murals really display the vitality, the industry, and the creativity that have long defined Harlem. Now, 6 years after they were recovered for restoration, these murals are back for the world to see. And I did want to thank our team at the Public Design Commission, and particularly Executive Director Jackie Snyder for her leadership, as well as the HHC staff and their commitment to the project, and all of the conservationists and artists who painstakingly worked very hard to restore these national treasures to their original glory. Over the past 7 years, our administration has implemented a sweeping $1.3 billion expansion and modernization of HHC hospitals, one of the most significant capital transformations in the history of the public hospital system. And that includes building a new outpatient service facility at Queens Hospital, a new behavioral health pavilion at Kings County Hospital, new acute care and outpatient service facilities at Jacobi Medical Center in the Bronx, and of course the Harlem Hospital Mural Pavilion. And these new facilities are helping to make sure that New Yorkers continue to have the best public health system in the nation. HHC and its dedicated medical professionals provide world-class care to 1.4 million patients every year. They handle more than 1 million emergency department visits every year, and they deliver some 23,000 babies every year. And they always give their best to all of their patients, regardless of income, insurance coverage, or immigration status. And they're one of the reasons why life expectancy among New Yorkers is 3 years longer than it was back in 2005, as compared to 1.5 years longer in the rest of the U.S. And over the last decade, HHC has greatly improved its operations, winning impressive marks from independent hospital accreditation teams. But we can't do everything that needs to be done alone, and that's why the fund for HHC is so important. The fund supports a number of innovative programs, including efforts to improve children's access to health care, raise self-esteem among young men, and reduce violence. This really is a great day for Harlem and for all of New York. I don't think anybody here, me included, really gets a sense of what the rest of the country and the rest of the world is like until you really go there and you see. In New York, we really are blessed by a lot of people, you included, who've really tried to make a difference and understand that we are certainly all in this together, and we've got to make sure that everybody gets the kind of health care that medicine is capable of providing. So on behalf of the entire team here at Harlem Hospital and all New Yorkers, thank you for all you do. I'm going to leave you to listen to some great speakers who are going to tell you more about it. I am heading over to Staten Island for another event, but I will be kept in touch. This better go well, Alan. You just make sure everybody gets introduced in the right order. God bless and thank you, everyone.